Hello and welcome. I'm Dr. Keith Lynch. I've been in private practice here in Charlottesville since 1998, and today we're going to talk about disc conditions. Frequently I'm asked whether or not I can help patients with a disc condition, whether that be a bulging disc or a slip disc or whatever that term is that they use. And what I'm going to do is go through that with you so that you have a better understanding of exactly what we're talking about. Now, let's talk about the anatomy and physiology of the disc. First off, you have the bones in the spine around the disc. The bones go around the central nervous system or the spinal cord, and they have cartilaginous discs in between them. Now, the discs are made up of annular fibers that go around the outside of that disc, which hold it together just like a radial tire. In the center portion is something called the nucleus. It's a gel-like substance. So you have a bone above, a bone below, the disc is in between, and it's right up next to where that nerve comes out and goes out to the rest of the body. So when we talk about our disc conditions, let's get our nomenclature correct, or talk about them as they are. So this would be considered a bulging disc. What they refer to with a bulging disc is you're starting to see some tearing, some damage to those annular fibers that go around the outside and hold it together. And because of it, the nucleus is starting to move. And what happens is that can start to change the shape of that disc to the point where it's pushing up against a nerve root. As that condition progresses, it will become what's called a herniated disc, where now the nucleus is pushing out up against those annular fibers, the ring, into the nerve root. It can further get damaged to where those rings actually completely fail, and now the nucleus is coming through there in what they're showing in regards to a ruptured disc. And then if it's sequestered or fragmented, that means not only has it torn open and come out, but there are actually pieces of it that are out there that are either pushing up against the spinal cord or the spinal nerves. Now, what we want to know about this is, how does this disc area work in health? So up to the age of 20, there's a good blood supply that comes through the bones to those discs. After the age of 20, there's a mechanical action that allows the nutrition or the metabolites within inside that disc to go in and out of it, because that's how it basically lives. It's through proper motion. So when you wake up in the morning, you're literally at your tallest. As you go through the day, gravity presses down on our bodies, and it presses down on these disc spaces, and the metabolites inside the disc move out into the capsule around it. And then when you lay down at night, the weight of the head and shoulders and the legs and hips pull that spine apart, and those metabolites go back into that disc space, and once again you're at your tallest. So that's normally what should happen. So how do you get to a condition like this where it's starting to bulge or herniate or rupture? Well, there's a couple ways. One is through trauma. Car accidents, sporting accidents, micro traumas, repetitive stress injuries. What can happen is the vertebrae themselves can get out of alignment. And when that happens, it changes the way the force or pressure gets put onto the disc itself. And when that happens, we start to see damage happening to that annular fiber area, which is what allows that nucleus inside to start moving and migrating and pushing that outer shape of the annular fibers, which can press up against the nerve roots. When it presses up against the nerve roots, that's what can create pain. Correct? Okay. Now, what we need to know is this is the cross-section of the peripheral nervous system. So those nerves that come out of the spine, they look like one little nerve at first, but what you're really seeing is a braided type of effect, where you've got several different types of nerve fibers coming out of the spine, going out to the periphery. You have your motor nerves. Motor nerves are going to go out to muscles, and if you have pressure on there, you're going to see weakness, you'll see spasms, you'll see fatigue, and you'll see tiredness. That's what happens when a motor nerve's getting affected. To you, the muscles that it goes to may feel short, tight, and achy, kind of like a toothache going all across that area. When I test it, I'll test it, it'll be weak. Now, you also have autonomic nerves which go out to your organs and bring information back to the brain from those organs. And if those nerves have pressure on them, you'll have sinus and allergy issues. You could have low energy. You could have digestive problems, breathing problems. That's part of your autonomic nervous system. And 10%, only 10% of the nerves carry pain information. So if you're feeling pain or hot and cold, that's coming from the pain nerves. That's why when somebody says, wow, my back went out last week and I took all these medications and I laid down and I iced it, and you know, I'm feeling better, I feel like everything's okay now. What that tells me is you probably got enough inflammation down that it's not pressing on those pain sensory nerves anymore, but you're still going to have pressure on the nerves. That's only 10% of the nerve that carries pain. So I show this because some people say, well, it only bothers me once in a while, or it's only happened a couple times. Frequently, someone will come in and say that, and as I test them, and we test the nerves that go out of the spine, out to the periphery, we'll find the weakness there, and they'll go, wow, I didn't even feel that. It's because it's only 10%. So whether or not you're feeling good doesn't tell us whether or not you're fully healthy or fully functional. It's function that determines how healthy you are. So that's why we use that to determine where problems are. Now, typically, if you've got a bulging disc or a slip disc or whatever you want to call that, if you go the medical route, these are the typical interventions that you'll see, possibly even in this order. You go to your medical doctor and tell him or her what happened, and typically they may send you for some therapy, for some stretching and strengthening. Try to strengthen around that area to protect it better. I can understand that. But that doesn't get that disc pushed off of that nerve root. It doesn't change the alignment of that spinal misalignment, so you're going to continue to have degeneration there. Remember, we talked about that. If it's not moving properly, that disc is wearing out, so it's constantly getting more and more pressure on it, and it's going to thin. You'll develop bone spurs around it. They'll call it osteoarthritis. They'll call it degenerative disc disease or degenerative joint disease. So stretching and strengthening, although they can be helpful, they're not going to move that disc off the nerve root. Another thing that they'll often do, one of your first rounds of therapy, will be pain medications, or they'll give you muscle relaxers or a combination cocktail of some type of pill to get you to not feel the pain. My main point on this is it's not going to move the disc. You're still going to have the problem underlying there, although you won't feel it. After medications, they'll take it one step up. You'll probably go to pain management. The way they manage pain is by trying to block it from getting to your brain. So they do that with chemicals. They'll do it with steroids. They'll do different types of pain relieving injections into the joint to try to reduce the amount of pain that your brain is feeling. And the last option, I hope, would be radio frequency to actually burn the nerves, followed by surgery where they may go in and either cut bone, shave bone, or fuse the joints together. Those would be my absolute last options. However, that's not my first option. My first option would be the approach that we take here, because it's non-invasive and it still gives you all those other options down the road if you need them. But this is what I would do. When I get with a patient, the first thing I'm going to do is I'm going to take a thorough history. We're going to find out what type of traumas you've had in the past. How did this present this time? What have you done in the past that made it better? What's made it worse? Is there a time of day that it's worse? Activities that make it worse? Those are the things that I'm listening for when we do our history or consultation, to really understand what the problem is that you're having. Because I should be able to listen to what you're telling me, and if I get enough of the right information, I should have 70 to 80% of the picture just from taking that history with you. And then we go in and we do a focused examination, including orthopedic and neurological tests, where we can test that information to see what's going on there. What type of a disc condition or nerve condition do you have? What's it affecting? Finally, we'll do weight-bearing x-rays. Now this is important because if you get an MRI, if it's done around here in Central Virginia, it's going to be done laying down. Oftentimes when patients are in pain, they'll go to the hospital. The hospital will take their x-rays laying down. I recommend weight-bearing x-rays because the spine and the discs are a weight-bearing structure. In other words, you know what a flat tire looks like? Looks like a flat tire. But if you put it up on a jack, it doesn't look flat anymore. So if you take a spine and lay it down and take a picture of it, that's not really what it's going to look like. We want to see what it looks like while it's bearing weight. So if we do all that, typically we'll be able to figure out exactly what's causing the problem. In 90% of the cases, by the time I'm done with that, I just need to see the films before I can tell the person whether or not I can help them and what it's going to take. And in my office, when you come back for that report, I have every little detail written out on paper for you. What's wrong? What do we need to do? How are we going to fix it? How long is it going to take? How much is it going to cost? Does my insurance cover this? How much does my insurance cover? And how can we make this work? Once we cover that together, then we talk about our treatment approach. Now, in our office, when we do our treatments, we use instrument adjusting. So let me explain that. And I explain this partly in another video where I talk about Atlas orthogonal. But if the top bone in your neck is out of place and it puts that head higher on one side than the other, you're not going to walk around like this. You'll walk around like this. And that'll put a curvature through the spine. Remember, we talked about how the weight bears on those discs. We want it to be even. We don't want it to be like an ice cream sandwich. You bite down on the cookie, soft stuff or ice cream moves out in the other direction, because that's going to be a chronic disc problem. So we have an instrument adjusting program for that top vertebra in your neck called the Atlas. We also use an instrument for the rest of our chiropractic adjusting program. We do that because it can be very specific in the angle, the amount of force that gets delivered to those discs. We don't want to be twisting, popping, or cracking. No high velocity, low amplitude, quick bursts of pain into that spine. Just small adjustments to make that disc get off of that nerve root. The other thing that we'll do in our office is we'll use cold laser. Cold laser I've been using in my office for over 10 years now. I started in 2006 using cold laser, and we've been seeing fabulous results with disc conditions because it really goes in there. It helps reduce pain, swelling, and inflammation. It improves circulation to those structures, and it can help them heal very quickly. We also use a percussion instrument. Now, to you, it would feel like a massaging tool, but what you need to know is the outside covering of the muscles is a glycoprotein or a sugar protein. And over time, when those muscles are out of balance, those sugar proteins break down and they stick together or adhere. When that happens, those adhesions create scar tissue, which can limit range of motion. It can put pressure on blood vessels and nerves, and that slows down your healing. So by removing or releasing that scar tissue, we can speed up the healing and the motion through that spinal area. The other area that we address are upper and lower crossed syndromes. So what do I mean by that? Well, if I'm standing sideways and I've got an upper cross syndrome, that means that the muscles from my SCMs that pull my head forward, the sternocleidomastoid muscles, kind of do this to the head. And you get a tightened muscle on one side and a weakened muscle on the other. Just like if somebody were to flex their bicep, the brain turns on the bicep, it turns off the tricep. It's called reciprocal inhibition. And we frequently see that in spinal conditions that involve nerves and discs. So we want to release or stretch the over-tightened muscles, followed by strengthening the muscles on the opposite side of the joint, because it's going to make that joint more stable so that it doesn't injure as easily while you're going through your treatment program. And when you're done, you've got a much more stable spine that you're going to be working with, because that's our goal. Because it's important to address the spine in its proper range of motion. So what I mean by that is when we use our instrument adjusting to set a disc, see, when you look at the spine from behind, you can't even see those discs. You have to rotate it around so that you can get at it from the front and adjust that disc this way. So we use an instrument to do that, to make that correction. It's a very gentle correction and a very specific correction, but it makes all the difference in the world when it's done right. Because when an area of the spine doesn't move properly, then it doesn't have what we call coupled motion. So if I take this instrument here and bend it just like that, what you should be able to see is a relatively even amount of opening on each of these joints as they open. That's called coupled motion, and that's what happens when the spine bends like that. If you have an area that's not moving properly, like a subluxation or a misalignment of vertebra in your neck, when you go to move, this is what happens. This area doesn't open or close. These do, and they open more than they're supposed to. So we want to prevent that from happening. Incidentally, if you have spinal surgery where they fuse an area, you're going to have that same thing. So if they say, well, you've got a problem at C5 and 6 or L4 and 5 down in your lumbar spine, and they fuse it like that, well, this is what's going to happen to the rest of that area. Eventually, it's going to start deteriorating because the ligaments that hold those bones to bones are going to start getting stretched and irritated, and then you're going to start seeing more degeneration there. So my offer that I'm making, because you've watched this video and you've been educated on this, is that I will do a consultation with you like I just talked about, where I really listen to what your condition is. After that, we'll do that comprehensive examination, which includes our orthopedic and neurological testing. We'll take any necessary films that are needed, and we'll do all, and you'll get that written report of findings as well. And we're going to do all that for $77. Now I got to tell you, if I take 2 x-rays, that's going to cost you $80 right there. So all of these services together would normally cost $77. Well, with this offer, they're going to cost $77. Normally, they'd be up in the range of $249. So this is a great opportunity for you to get a second opinion on your condition to see whether or not you're a candidate for our procedures or whether or not you're waiting to have surgery down the line. I'm hoping that it's not the second of those two. So please do take us up on this offer. This excludes federal beneficiaries. My name's Dr. Keith Lynch. I look forward to working with you and helping you. Feel free to call us at 434-245-8456 and get your appointment today.